Welcome to WA Health and Care, where we explore how to heal and live better. In today's video, we'll uncover natural ways to manage type 2 diabetes, inspired by Dr. Emily Harris from the London Diabetes Centre. Stay tuned to learn simple yet powerful steps to protect your long-term health naturally. First, we discussed what is the type 2 diabetes. Explianations. Type 2 diabetes is a long-term metabolic disorder that affects how the body uses glucose, the main source of energy. Normally, a hormone called insulin, produced by the pancreas, helps move glucose from the bloodstream into the cells, where it is used for fuel. In type 2 diabetes, this system doesn't work properly. Either the body doesn't make enough insulin, or the cells become insulin resistant, meaning they no longer respond to insulin effectively. As a result, sugar builds up in the blood instead of entering the cells, causing high blood glucose levels. Unlike type 1 diabetes, which usually develops in childhood and is an autoimmune condition, type 2 diabetes typically appears later in life and is strongly linked to lifestyle factors such as poor diet, lack of exercise, being overweight, and chronic stress. However, genetics can also play a significant role. According to Dr. Emma Collins, a diabetes researcher from the University of Cambridge, UK, type 2 diabetes is one of the fastest-growing health challenges in the developed world, yet it is largely preventable through lifestyle awareness and timely care. Common signs include excessive thirst, frequent urination, fatigue, blurred vision, and slow-healing wounds. If left untreated, it can lead to serious complications such as heart disease, kidney failure, nerve damage, and vision loss. At WA Health and Care, we emphasize the importance of early detection and natural prevention, through balanced nutrition, regular activity, and stress management. While type 2 diabetes cannot always be cured, it can often be controlled or reversed with consistent lifestyle changes and medical guidance. 1. What are THR causes of type 2 diabetes? Type 2 diabetes develops gradually when the body stops using insulin properly, a condition known as insulin resistance. Over time, the pancreas cannot produce enough insulin to maintain normal blood sugar levels, leading to high glucose in the bloodstream. This imbalance is influenced by a mix of lifestyle, genetic, and environmental factors. One of the leading causes is unhealthy diet. Consuming processed foods, refined carbohydrates, and sugary beverages places constant stress on the body's insulin system. According to Dr. Laura Bennett, a metabolic health specialist from Harvard Medical School, USA, high-sugar diets and fast food habits are silent drivers of insulin resistance, the root of type 2 diabetes. In both the UK and USA, growing dependence on high-calorie, low-nutrient meals has contributed to the rapid rise of diabetes cases. Physical inactivity is another major cause. The less you move, the less efficiently your body uses insulin. Regular exercise helps muscles absorb glucose for energy, lowering blood sugar naturally. Sedentary lifestyles, often linked to long office hours or screen-based routines, make it harder for the body to regulate insulin effectively. Obesity, particularly abdominal fat, is closely tied to type 2 diabetes. Fat cells release inflammatory chemicals that interfere with insulin signaling, making it difficult for glucose to enter cells. Studies from the National Health Service, UK, show that losing even 5 to 10% of body weight can significantly improve insulin sensitivity. Genetics and family history also play a key role. If a parent or sibling has type 2 diabetes, your chances increase due to inherited insulin resistance tendencies. However, having a genetic risk doesn't mean diabetes is inevitable. Lifestyle choices still matter most. Other contributing factors include chronic stress, poor sleep, and certain medical conditions such as high blood pressure or high cholesterol. Stress hormones like cortisol raise blood sugar levels, while lack of sleep disrupts metabolism and appetite control. At WA Health and Care, we emphasize that while some causes are beyond control, most are preventable with awareness and healthy habits. Choosing balanced meals, staying active, managing stress, and getting regular checkups can drastically lower your risk. Type 2 diabetes isn't sudden, it's a slow process shaped by daily choices, and understanding the causes is the first step toward prevention. 2. What are the symptoms of type 2 diabetes? The symptoms of type 2 diabetes often develop slowly, so slowly, in fact, that many people live with the condition for years without realizing it. Because early signs can be mild or mistaken for normal fatigue, type 2 diabetes is sometimes called the silent disease. Recognizing the symptoms early is essential to prevent long-term damage to vital organs such as the heart, kidneys, eyes, and nerves. One of the most common warning signs is frequent urination, polyuria. When blood sugar levels are too high, the kidneys work overtime to filter and remove the excess glucose through urine. This leads to excessive thirst, polydipsia, the body's natural attempt to replace lost fluids. Together, these two symptoms create a cycle of dehydration and fatigue that many people initially overlook. Another early indicator is unusual hunger, polyphagia. Even though there's plenty of sugar in the bloodstream, it can't enter the cells because of insulin resistance. As a result, the body feels starved for energy, triggering constant cravings, especially for carbohydrates and sweets. Fatigue and blurred vision are also typical signs. High blood sugar affects the flow of oxygen and nutrients to tissues, leaving you feeling tired even after rest. Extra glucose can also cause the lenses of the eyes to swell, leading to blurred or hazy vision. Many people with type 2 diabetes experience slow-healing wounds, recurrent infections, or tingling sensations in their hands and feet. These occur because high blood sugar damages small blood vessels and nerves, reducing circulation and weakening the immune system. Skin problems, such as dryness or dark patches around the neck and armpits, a condition called acanthosis nigricans, can also appear as early warning signs. According to Dr. James Porter, a leading endocrinologist from Cleveland Clinic, USA, the earlier type 2 diabetes is detected, the easier it is to reverse or control. Many patients ignore subtle symptoms until complications develop. That's when the real risk begins. At WA Health and Care, we encourage everyone to take even mild changes seriously. Regular health screenings, a balanced diet, and active living can help detect and manage type 2 diabetes before it silently harms your health. Awareness truly is the first step toward prevention. 3. What are the exercises and lifestyle tips for managing type 2 diabetes? Managing type 2 diabetes isn't just about medication, it's about making consistent, healthy choices that balance your blood sugar, improve energy, and protect your heart. As Dr. Emma Richardson, a leading UK-based diabetes specialist at NHS England, explains, lifestyle changes are the strongest form of medicine for controlling type 2 diabetes. When the body moves, glucose moves too, into the muscles, not the bloodstream. Regular physical activity is one of the most effective ways to keep diabetes under control. Exercise helps your cells use insulin more efficiently and lowers blood sugar naturally. For most adults, at least 150 minutes of moderate activity per week, such as brisk walking, swimming, or cycling, is ideal. Even small actions like taking the stairs instead of the elevator or walking after meals can make a noticeable difference. Strength training 2 or 3 times a week also helps build muscle, which increases your body's ability to burn glucose for energy. Activities like lifting light weights, using resistance bands, or doing yoga can strengthen both your muscles and your metabolism. Alongside exercise, healthy eating plays a vital role. Choose whole grains, lean proteins, vegetables, and healthy fats while avoiding sugary drinks and processed foods. A balanced plate, half vegetables, a quarter protein, and a quarter whole grains, can help stabilize blood sugar levels throughout the day. Drinking plenty of water instead of sugary beverages further supports hydration and glucose control. Weight management is another key factor. Losing even 5 to 10% of your body weight can dramatically improve insulin sensitivity and reduce the need for medication. Regular sleep and stress management, through deep breathing, meditation, or spending time outdoors, also help regulate blood sugar by keeping your hormones balanced. Finally, never underestimate the power of routine checkups. Monitoring your glucose, blood pressure, and cholesterol levels helps you track progress and adjust your lifestyle effectively. At WA Health and Care, we believe every small step counts. Whether it's a morning walk, a healthier meal choice, or 10 minutes of stretching, your consistency matters more than perfection. So, tell us, which healthy habit would you like to see explained next? Exercise routines, diabetic meal planning, or stress management for better glucose control? 4. What are the precautions for type 2 diabetes? Living with type 2 diabetes requires more than just medication. It demands awareness, prevention, and smart daily habits that protect your body from long-term complications. As Dr. Michael Carter, an American endocrinologist from the Mayo Clinic, often says, diabetes management is not about perfection, it's about prevention, small, consistent actions that protect your future health. The most important precaution for people with type 2 diabetes is regular blood sugar monitoring. Tracking your glucose levels helps you understand how your diet, exercise, and stress affect your body. Early detection of abnormal readings allows you and your healthcare provider to adjust your plan before complications occur. Maintaining a balanced and consistent diet is equally crucial. Avoid skipping meals or overeating. Choose fiber-rich foods such as whole grains, beans, fruits, and vegetables to keep blood sugar stable. Limit refined carbs, sweets, and sugary beverages, as they can spike glucose levels and lead to fatigue or insulin resistance. Another key precaution is staying physically active. Daily movement helps your muscles use glucose efficiently and supports cardiovascular health. However, if you take insulin or blood sugar-lowering medications, always check your glucose before and after exercise to avoid sudden drops, hypoglycemia. Foot care is a vital but often overlooked part of diabetes management. High blood sugar can affect nerves and blood flow, leading to slow-healing wounds. Check your feet daily for cuts or blisters, wear comfortable shoes, and visit your doctor regularly for foot exams. Hydration also plays an important role. Dehydration can increase blood sugar concentration, so aim to drink enough water throughout the day. Avoid alcohol or limit it, as it can interfere with glucose levels and liver function. Another precaution involves stress and sleep management. Chronic stress increases blood sugar by releasing cortisol, the stress hormone. Practice relaxation techniques like meditation, deep breathing, or gentle yoga to balance both your mind and body. Lastly, never skip medical checkups. Regular visits to your healthcare provider for blood pressure, cholesterol, kidney, and eye tests can help detect early signs of complications. At WA Health and Care, our goal is to educate and inspire you to take control of your health. Prevention truly is the best cure. So, what topic should we cover next? Diabetic diet plans, eye care, or managing stress with type 2 diabetes? Tell us in the comments below. 5. What are natural treatments for type 2 diabetes? Managing type 2 diabetes naturally doesn't mean avoiding medical care, it means supporting your treatment with healthy, science-backed lifestyle habits. As Dr. Emily Harris, a UK-based diabetes specialist at London Diabetes Centre, explains, natural management is about helping the body regain balance through mindful nutrition, movement, and consistent care. One of the most effective natural treatments is a plant-based, low-glycemic diet. Foods like leafy greens, oats, lentils, berries, and nuts help stabilize blood sugar without heavy insulin spikes. Replacing refined carbs with whole foods can significantly improve insulin sensitivity. Many American nutrition experts recommend the Mediterranean diet, rich in olive oil, fish, and vegetables, for its heart protective and glucose-regulating benefits. Cinnamon and turmeric are two natural ingredients often highlighted for their potential to lower blood sugar levels. Studies from the National Institute of Health, NIH, show that cinnamon may improve the body's ability to use insulin effectively, while turmeric's active compound, curcumin, helps reduce inflammation, a major factor in insulin resistance. Regular exercise acts as a natural medicine for the body. Activities like brisk walking, cycling, swimming, or yoga help muscles absorb glucose efficiently, lowering overall blood sugar levels. Even 30 minutes of moderate exercise daily can make a lasting difference. Proper sleep and stress management are equally vital. When you sleep well, your body regulates hormones better, keeping glucose in balance. Stress, on the other hand, increases cortisol, which can raise blood sugar. Deep breathing, meditation, or spending time in nature can naturally calm your nervous system. Herbal support like bitter melon, fenugreek seeds, and aloe vera juice are traditionally used to manage diabetes, though they should be taken only after consulting a qualified healthcare provider. These herbs may assist in lowering blood sugar, but their effects vary per person. Hydration also matters more than most people realize. Drinking plenty of water helps flush out excess sugar through urine and prevents dehydration, which can worsen blood sugar control. At WA Health and Care, we believe natural treatment is not a replacement but a powerful partner to your medical care. When used wisely, these natural methods can improve energy, reduce medication dependency, and help you live a fuller, healthier life. Now we'd love to hear from you. What natural remedy or lifestyle tip worked best for you? Or should our next video explore the diabetic-friendly meal plan? Let us know in the comments below. Thank you for watching WA Health and Care. Remember, as Dr. Michael Carter from the Mayo Clinic says, consistency beats perfection in managing diabetes. If you found this video helpful, please like, share, and subscribe. Tell us in the comments, which topic should we cover next in our health series?